And it's time to meet today's panel, who are going to be answering your questions on the coronavirus this evening. We're joined by the clinical lecturer Natalie McDermott at King's College London, the travel journalist Jill Starley-Grainger, and GP Dr. Sarah Kayat. Thank you very much, all of you, for being on the programme today, answering some of the questions sent in by SkyNews viewers. Let's crack on, shall we? The first question is going to be going to Natalie McDermott, if that's all right. Marilyn sent this question in for Natalie. I've seen key workers walking around supermarkets wearing their uniform. Could the virus be on their uniforms? Could it, Natalie?
Well, I think the answer to that is it's very unlikely, because any key workers who are having contact with known cases of COVID-19 will be wearing a gown to protect their uniform. So it's very unlikely that they would be carrying it on their clothing. Obviously, it is a possibility that clothing could have the virus on it, but that's the same for anyone in the community. And I don't think that key workers should be treated any differently. If they had been exposed during their job, they wouldn't be walking around in the same clothing that they had been exposed in.
Hopefully that's a reassuring for Marilyn. We've seen, of course, some of those awful cases of key workers, NHS staff receiving abuse, so hopefully that goes some way to reassuring people. Let's talk now to Jill Starley-Grainger, shall we? The first question for Jill from Despina, who asks, why are people still flying into the UK without being quarantined for 14 days? Jill.
So it's my understanding that the restrictions around that were lifted some time ago. Public Health England consulted with the World Health Organization, and it was determined that that wasn't really the main risk anymore. The main risk is within the UK. It's already here. So people coming into the UK from abroad are no more likely to bring it in than anybody traveling from within the UK. So the restrictions would simply be, when you come into the UK, you behave as everybody does right now, which is self-isolating.
OK, thank you very much, Jill. Let's talk now to Dr. Sarah Kayat. A question for you from Craig, who has asked, I've had 2 stents inserted in my right main artery in my heart in January. Am I high risk? I've gone back to work as a key worker. Craig, obviously a bit concerned there. What is the reality?
Well, we do know that people with underlying cardiovascular issues, so heart problems, are in a higher risk category. So they would be considered someone with an underlying health condition, and therefore someone that should ideally be working from home if possible, and should be socially distancing quite strictly if possible.
And so does that mean that if Craig is a key worker, it's something that he might be able to raise with his employer, do you think?
Absolutely. I think with all of these cases, it's so important to discuss with your employer the best way forwards. A lot of the times, employers are able to put you in positions where you may be less, patient-facing or public-facing if you are a key worker, and may be able to put restrictions in place so that you're ensured that you're 2 meters away from others and things like that. So I think it is important, if you do have an underlying health condition, to have that conversation.
Some very useful advice for Craig there. Of course, we don't know exactly what Craig does, but hopefully that gives Craig a little bit of advice on the best steps forward. Right, let's go back to Natalie McDermott now, the clinical lecturer. And this question's been sent in from Nazrat, who's asked, can we give plasma from recovered patients to actively infected patients? Would that work?
So there have been some discussions about trialling that. And it has been considered. I'm not sure it's actually part of an active clinical trial at the moment, but it is certainly something that has been considered. The problem with taking plasma from someone who's recovered is that we don't yet have an antibody test to know just how much antibody each person has. And just because there might be several people who survive the infection, they won't all have the same amount of antibody in their plasma. So we can't just take a unit of blood from someone, separate the plasma and give that to someone who's unwell. We have to look at the amount of antibody they have in their plasma as well, because there's probably some threshold where you do have to have a certain amount of antibody for it to be beneficial for people. So it's still being discussed and looked at whether that would be a possibility.
Interesting. So something that we could be exploring, but potentially a little bit early now to really work out if it's going to have much benefit. Let's talk now to Jill again. And Dan sent in this question for you. I was due to fly to Las Vegas, but I followed the government advice and I didn't travel. Why is the flight company unwilling to provide me with a refund?
They should be willing to provide you with a refund if the flight was cancelled, because if the flight's cancelled, you are due a refund, but you do have to apply for it. So we don't know the dates in the situation. If the flight was not cancelled, what you then have to rely on is your travel insurance, and travel insurance would cover that, because travel insurance covers you whenever the Foreign Office advises not to travel. So in that situation, you would have to go to your travel insurance. But if the flight itself had been cancelled, then the airline should refund you.
So actually maybe not talking directly to the airline, but going directly to your travel insurance might be the key to unlocking this money then?
That's right, yeah.
OK, right, let's talk to Dr. JessiCat now. This is from Dave, this question for you. And actually, I think this is one that maybe quite a few people who are suffering from symptoms might be interested to know the answer to as well. How do we judge how bad our breathing needs to be in order to call an ambulance?
I completely agree. This is a question that we're getting asked quite a lot. I would suggest if your breathing is usually absolutely normal and you have no problems, then a change in your breathing warrants a call to your GP. You know, you should definitely have that chat with your doctor. If it's out of hours or weekends and your breathing is to the point where actually you can't get up to make a cup of tea or go up a set of stairs when normally you'd be absolutely fine to, that is something that needs medical support. And therefore, I would pick up the phone, call 111 and go from there. You'll need to be assessed by them. OK, some really useful advice there for anyone who is concerned about breathing difficulties, symptoms of coronavirus. And thank you for that. Right, let's go back to Natalie now. Manwa has sent in this question for Natalie. Is COVID-19 airborne?
So I think people get a little bit confused about what the term airborne means and what aerosols mean. So COVID-19 is droplet spread. So that means that if we cough and sneeze out droplets, and that person who's coughing and sneezing is infected with COVID-19 and somebody else is close by and inhales those droplets, or they come into contact with their eyes, then they can become infected that way. But when we talk about airborne spread, we're talking about the virus being able to be carried almost on microparticles of dust in the air for significant distances, and it be spread in that manner. And this virus cannot be spread in that manner, but it can be spread through droplets that are coughed and sneezed out to people who are nearby.
And does that I guess, is part of why we're having the distancing, the social distancing is so important, the kind of 2 metres away from everybody?
Yes, that's one of the reasons for the 2 metres. So obviously droplets can go further than 2 metres, but it's generally felt that the vast majority of droplets will spread at approximately that 2 metre distance if someone were coughing or sneezing or breathing very heavily.
OK, well, let's go on to another holiday-related question, shall we? Jill, Starley-Grainger, this is from Gareth, who's asked, I have a holiday booked for June that's due to be paid. I have the option of free cancellation now. Should I cancel or pay and hope for the best? June, of course, not that far away now.
If you have the option of free cancellation, I would probably take it. I really think the chance that travel is going to be back to normal by June to be quite slim. So if the company has said you can cancel and we'll give you your money back, I'd probably take that option. Or if they're saying you can move it to another date in the future, maybe do that. Of course, they might be saying you can make any decision, you know, you have time to make the decision. The one thing you should not do, though, is take vouchers or a credit note. So either just cancel and get your money back, or go ahead and move it to a date in the future, because in both cases, your money would be protected. But if you take vouchers, if the company goes bust, that money disappears. It's not protected by any financial scheme whatsoever. So I would either cancel or move the date.
It's interesting to hear you say that you're pretty sceptical that the travel restrictions will be lifted by June. Do you think it could be one of the last things, if you like, to be lifted when the lockdown does begin to be eased?
I mean, I don't know. I'm just basing this on sort of people I've spoken to in the industry. I think it's maybe possible that UK travel, for example, might be lifted sooner. So obviously we don't know where he's talking about. If it's somewhere abroad, though, I would be very surprised if we are traveling as normal by June, based on what's happening all around the world. So at my best guess, that's what I would do, especially if the company's gone ahead and said you can go ahead and cancel for free.
OK, Gareth, the advice there is to go for the free cancellation if you have that option. And Dr. Sarkayat, Bob sent in this question for you. My wife has COPD and works at a GP surgery. Should she be there?
So COPD, again, is one of the underlying health conditions that we would worry a bit more about in terms of the consequences of COVID-19. Now, it depends on how severe her COPD is. If it's mild to moderate, then some people are able to continue with work with as much for social distancing as she can. So I don't know what role she has at a GP practice. If she's an admin staff, for example, she may not necessarily be patient-facing. But if she has severe COPD, that is one of the groups of people that need to be shielded. And therefore, she needs to not be at work and she needs to be in an isolated circumstance. Again, this is one where she needs to speak to that employer and say, you know, what's the best way to protect me?
OK, sounds like Bob's wife then needs to have a conversation with her place of work there. Dr. Sarah, thank you very much for that answer. And thank you all for some really illuminating answers in the first half of that. We are going to be answering more of your questions after this break, so don't go anywhere. Thank you. Hello again. Time now to carry on with the second half of tonight's questions that everyone's been sending in on the coronavirus. Quick reminder of our panel. We're joined today by the clinical lecturer Natalie McDermott at King's College London, the travel journalist Jill Starley-Grainger and the GP Dr. Sarah Kayat. Thanks all of you for sticking around. Let's have a quick look at the first question for Natalie that's been sent in by Steve. Lots of people, of course, getting deliveries to their houses at the minute, so I think lots of people will be quite interested in this answer. What precautions are necessary with fruit deliveries? How long could the virus live on them?
Well, I think that you need to have a discussion perhaps with the people who are delivering the fruit or the company that's delivering the fruit, provided that's being handled by someone who doesn't have any symptoms or someone who's wearing gloves. Really, there shouldn't be too much of a risk. I mean, you should always wash fruit anyway before you eat it, but usually we just wash it with water, which normally wouldn't be sufficient to kill the virus. But I don't think you need to start washing fruit and vegetables with soap or anything like that. It's probably going to do more damage to the fruit and veg than it benefit. So I think just take the standard precautions and make sure you wash your hands after handling it. And if you're really concerned, you can always peel the fruit and veg and dispose of what you've peeled and then make sure you wash your hands afterwards. OK, thank you for that advice there, Natalie. I mean, I guess we have to eat, don't we? It's all kind of weighing up risks. So, Jill Starley-Grainger, let's have a little look at the next question for you. This is sent in from Jodie, who said, I'm due to fly to Thailand on Friday. If I still want to go, will I be able to get the insurance?
No, absolutely not. There is no insurer that would cover you to travel right now from the UK. So if you go, obviously it's at your own risk. I would be surprised if the flights are even still operating. But if they are operating, if you do go and anything happens to you, you could have a huge medical bill. I really would not advise traveling right now. You should be able to cancel. If you already have travel insurance, you should be able to cancel and get your money back from your travel insurance. And if the airline has canceled the flights, which most of them probably have, the airline is due to refund you your money as well, but you will have to claim that back from the airline. Sorry for the bad news, Jodie. Probably a bit optimistic to be hoping to go to Thailand on Friday. Carol sent in this question for Dr. Sarah. Let's have a look at this one. If I have slight symptoms, is running helpful for the lungs or should I be resting?
We know that breathing exercises can help with respiratory conditions. So there is some thought process behind trying to expand the lungs if you are suffering with some symptoms of coronavirus. Generally, if you're feeling well enough to run, then it is okay. But you have to remember that if you've got symptoms, you should ideally be self-isolating as much as possible. Yes, the government have said you can go out for your 1 hour of exercise a day, ensuring that you're 2 meters away from other people. But I would be extra careful that you don't transmit what you have to others.
So actually it's perhaps not so much about yourself, but what it might do to those around you that you're concerned about there, Dr. Sarah. OK, let's have a look at the next question for Natalie, this is from Jazz, who asks, am I allowed to visit someone who's had the virus and is recovering from it?
I think at the moment we're all supposed to be social distancing and not visiting anyone, whether they're well or not. The question is, even if that individual has recovered from it, have they been tested? And if they have been tested, have they had a negative test? Because some people, even once their symptoms have resolved, can continue to carry the virus at the back of their throat for a period of time. So you shouldn't really be visiting anyone at this time period anyway. The government's advice is that we should all be staying at home and not having contact with anyone outside of the home unless it's absolutely essential. But if you were to visit someone, I certainly wouldn't visit them whilst they still have any symptoms whatsoever, and then for a good 48 hours at least after all of their symptoms have completely resolved.
OK, Jazz, so you're not allowed to visit someone who's had the virus and really shouldn't be visiting anyone at all. Thank you for that answer. Jill Starley-Grainger, question here from Coral. My cousin's stuck in Jamaica and has health problems. How can she get home? Lots of people, of course, struggling to get back to the UK from other countries.
So the Foreign Office, we know, is trying to arrange flights to get some people back home from some countries. So definitely check with the embassy there. But if there are any flights at all from Jamaica and you had a flight that had been cancelled, the airline is responsible for getting you back. So you need to speak to the airline, but let's say you had a flight with the Virgin Atlantic or British Airways or whoever it was, and the flight was cancelled. If you can get a flight on any other airline, your original airline is responsible for getting you back, or your travel agent if you booked through a travel agent. So you should check with them first, but then book that flight, and then they should refund you the money for that trip. That's really the best way. I don't know if any flights are running from Jamaica. Otherwise, really just try to put pressure on the embassy and explain to them the situation, because they are trying to prioritize destinations where there's a large number of Brits, and particularly those who have any illnesses. OK, a good answer there. Let's get the final question response, shall we, from Dr. Sarah Kayat, from Michael, who asks, is it beneficial to use a nasal rinse daily?
There's no evidence to suggest that using a nasal rinse will prevent you from catching coronavirus. If one of your symptoms from the coronavirus is that you're getting nasal discharge or nasal clogging, by all means you can do, but there's very little to suggest that nasal douching is going to stop you from getting it.
OK, thanks all three of you for a really informative session. Lots of questions that we rattled through. Natalie McDermott, Jill Starley-Grainger and Dr. Sarah Kayat, thank you very much.